In this video recording, I will be showcasing 4 instances of intumescent cataract wherein there is the danger of the Argentinian flag sign occurring on initiation of the capsulotomy. And in all the 4 cases, I have initiated the capsulotomy punching through with a phaco probe, with a phaco tip, using very low vacuum, very low outflow, and a very low pulse rate. So here's how it went. This is case number 1, pretty intumescent cataract. I'm not going to go in through all the details. After staining the capsule, there's the punch with the phaco tip, and using the irrigation, the chamber is pressurized. Before coming out, always fill in the chamber with dispersive OVD. This is very, very important. Don't suddenly come out of the chamber, as that sudden decompression would lead to the flag sign. Now, yes, I am trying with the Uthrata forceps, and you will have to snail track this rhexis. You cannot go and try. Some people can do it if you have fantastic control of the anterior chamber, but it would be better to do a snail track or a spiral rhexis. The problem with the snail track or a spiral rhexis is that loop of tissue that you generate can come in your way. So you have to keep it out of your way and keep extending the rhexis. This free tag is unlikely to extend into an Argentinian flag sign. It's very easily controlled, but you have to visualize and you have to be patient. So just move it away and then go ahead, catch it at the site of where it's attached, and you can go on extending your rhexis. If the rhexis is not adequate, you can always scallop it into a more adequate sized rhexis. And now come to case number 2. This is a diabetic cataract, an intumescent cataract, and a very hard nucleus. So again, after staining the capsule, pressurizing it with OVD, I go in with my phaco probe, punch through into the anterior capsule. You can see some of the cortex getting aspirated, but the irrigation fluid from your phaco tip will keep the chamber pressurized and not allow the flag to develop. Now, before coming out of the chamber, always pressurize your chamber with OVD. So you have to practice with your left hand. Now this has almost punched a fantastic 1 mm to 1.5 mm hole. This is just a small tag. I've taken it out. So, and this is like doing a mini rhexis. I've got the chamber pressurized. I'm not aspirating the peripheral equatorial cortex, just cutting the one edge of the rhexis, and again going to do a spiral rhexis. Do not attempt to do a large rhexis. You may get away with it sometimes. You are most unlikely to get away with it all the time. So when you do a spiral or a snail track rhexis, if you haven't aspirated the equatorial cortex and broken the equatorial block, this tag is pretty easy to control. And obviously you have to frequently put in OVD. It's because of this tiresome snail track rhexis and controlling this flap, I usually opt for the double rhexis procedure in an intumescent cataract. It's much faster in my hands. And see, you can see how this flap can just come out into the incision, and in fact come out of the chamber also. So I have snipped it. Don't try to pull on it. It will go to the periphery. And once I have snipped that, I then complete with my Utrata. Since this is a very hard cataract, I am going to extend this rhexis. Again, make a small tag and go round on the capsular margin. And you can fashion the rhexis of the size that is most comfortable for you to continue with phaco or with the nuclear disassembly. And now the third case, again an intumescent cataract. Here I punch the anterior capsule and then fill in OVD before I come out with my phaco probe. And this is a younger cataract. These capsules sometimes behave differently. I've gone in with a micro-rhexis forceps. And see, it's sometimes difficult when you go from the wrong area. It is difficult to hold on to that tag. I have finally got it. And decide that this is not the way. I go in from the other side and I find the Utrata far better to, although yes, it can cause a little OVD to escape, but it's much easier to control this tag. And I am trying to spiral it out. And that's definitely a very small rhexis. And now what I do is I'm just doing the same thing that I do in a double rhexis. I am going to now break the equatorial block using a Simcoe cannula. I can go in even from the side port, go and look, I am targeting that peripheral equatorial cortex. And at the same time, I am nudging and trying to rotate this nucleus. And once I've got that, I know I can just snip anywhere. Just to show you, I will be doing multiple scalloping in this case. So I've got one. I again snip it. This is just to show you, you don't have to do everything in one go. This is especially for not very well experienced surgeons. You can keep on scalloping this border to get an adequate rhexis. Don't try to do it in one go if you are not having the confidence or you're a little worried. Even experienced surgeons can do this. This is very safe. Keep scalloping the border till you get your adequate size rhexis. See how many times I am doing it. I have practically done it from all sides. And here I am using a Utrata forceps, a micro-rhexis forceps. And there I have got my full size rhexis. And now coming to the last case or last example, again after staining the capsule, I go in with my phaco probe and boom, I go in and see this has actually, the opening is slightly eccentric, it's not in the center, and that's probably I phacoed a little off-centered, and this is going to give me problems. Just watch it. So here, knowing that it's a little bit to the off center, I first take my micro rhexis forceps and just bringing it round, just trying to spiral it, and look what happens. I almost have pulled it out, but luckily it's not run away. So and this is what can happen. The tag, see, the tag is coming out, it's coming out of your incision. If you do not watch that carefully, you can keep pulling to the periphery. So now I have pushed it in back, snip it, first snip off that free tag. It's not yet gone. I cut it, and once that's cut, put in viscoelastic, push the tag away, and then you can, it's much easier to control now. And that's an eccentric but adequate rhexis. Thank you for watching.